So today's topic is inborn errors of metabolism, page number 463 onwards. Inborn errors of metabolism. Chapter is medical nutrition therapy. So inborn errors of metabolism, there is a chapter in nutrition science as well. But here we will see some other examples also. So first one is protein and amino acid metabolism issues, phenylketonuria, PKU, in short, what we call. So too much of phenylketones in a newborn baby's system, okay, because the child is not able to digest lactose, okay. Even the lactose in breast milk will also be completely stopped here in this condition, okay. So phenylalanine, that's the essential amino acid that is not able to be digested, okay. And phenylalanine is also present in breast milk, so this phenylalanine is not been able to digest it properly. There is no enzyme called phenylalanine hydroxylase, that is the enzyme. The absence of this enzyme will lead to undigested phenylalanine in the system, in the blood, too much of phenylalanine in the blood, and the kidneys will excessively try to remove it, okay. So that's how you get phenylketones in the urine, that is phenylketonuria. Okay. So children here, they have the blue eyes and blonde hair. Usually this condition is not that common in Indian children, Asians and Indians. It's Caucasian children who are most affected by it. It is also not that commonly seen in African children as well. Okay. There is eczema, hypertonia, seizures in certain children, okay. And if mothers during their pregnancy, if they're taking too much of phenylalanine in their diet, okay, phenylalanine amino acid is too high in their diet, that could lead to abortions, babies who have mental retardation, microcephaly, congenital heart disease in children. So as a for the treat, we can't treat it, it's a lifelong condition, okay. Lifelong these children have to be on a very specific diet that does not have lactose, okay, that does not have phenylalanine at all in their diet, okay. So low phenylalanine formula will be given. Lofenalac is one of the formula that is given to the children, and the contents of the food that can be given are you will find it on table 34.22, like ragi, jaggery, milk, rice, guava, greens, cucumber salad, carrot halwa, vegetable soup, oils, tapioca, arrowroot. These can be given. A model PKU diet is also uh, can be made out of it. How much phenylalanine is available in these food is given in the table. So milk has to be avoided, rice has to be avoided, certain greens, cucumber, because milk and rice they are high in phenylalanine, that has to be avoided. So items like cereals, pulses, bread, etc., you have to limit, okay. But you can liberally use low phenylalanine items like tubers, roots, vegetables, fruits like tapioca, cucumber, apple, grapes, guava, mango, papaya. They have low phenylalanine, so these can be used liberally. And you have to avoid high protein diet like fish, egg, meat, cheese, okay. You have to avoid it. Then you have tyrosine. Tyrosine is also synthesized by phenylalanine, and tyrosine is very important for the production of dopamine, adrenaline, noradrenaline, melanin. Thyroxine These are hormones, okay? For the synthesis of these hormones, thyroxine is very important. So in tyrosinemia, that is a condition when there is too much of tyrosine in the body, because again, phenylalanine hydroxylase enzyme is not present. So tyrosine is not synthesized properly, and it is present in the blood as it is not being absorbed. Okay, so elevated tyrosine levels are seen, in which the urine will smell like rancid, like fish, rotten cabbage smell will be there in urine. In such conditions, liver transplantation is also effective to cure this. Vitamin C supplementation can also help. Next is alkaptonuria. Because of the deficiency of homogenistic acid reductase, that's an enzyme. This enzyme is not produced in the child, which is used to cut down thyroxine, breakdown of thyroxine. So if this enzyme is not present, that would lead to arthritis, black color in urine, okay? And there is no effective treatment here in this alkaptonuria. Then homocystinuria. Homocysteine, if you remember, is a protein uh, that can cause lysis of breakdown of red blood cells. Okay. So this is the second most common type of inborn errors of metabolism. And when methionine, that's one of the essential amino acid, when that is degraded, you get homocysteine. So in when the child is suffering from homocystinuria, too much of homocysteine is produced, there could be RBC thrombosis in arteries and veins can happen, because red blood cells are getting broken down. So that will lead to clot formation within the circulating blood. Okay, so clot formation in arteries and veins can happen because of too much of homocysteine in the blood. So here you have to reduce any food that has too much of methionine in the in its content. Okay, methionine is an essential amino acid. Food that are low in methionine is given to homocystinuria children. So bread, oil, jaggery, sugar. Okay, bananas, they have very less methionine. Vegetable salad, soup, cucumber, apples, they are low in methionine. Low methionine formulas are also available. You have to restrict methionine as much as possible. Complete restriction, zero restriction won't be possible, because food have some or the other degree of methionine present in them naturally. Avoid food that are rich in proteins like egg, flesh food, meat, milk, etc. And cysteine is a non-essential amino acid that is also synthesized from methionine. In cystinuria or cystinosis, again, there is no effective treatment, because cysteine is something that is synthesized in your body, and that could be kidney stones in cystinuria. There are medications which have cysteamine or phosphocysteamine that can be used, that is effective in treatment. Then tryptophan, another essential amino acid. Too much of tryptophan or tryptophan, if it is not absorbed properly, that could lead to conditions like indicanuria. Indicanuria, in that tryptophan is not easily absorbed. It is converted into an indole in the gut by the gut bacteria, and indole is converted into indican. Okay, and it gets absorbed by the intestine. but not in the form of tryptophan, in the form of indican. And that will change the color of the urea. Okay, so it is also called as the blue diaper syndrome. And the treatment of this is give less protein in diet, because tryptophan is present in high protein diet. So if there is too much of tryptophan present, it could lead to too much of indican that is being absorbed, and it could continue the blue diaper syndrome. Then you have branched chain amino acids. So under that, there are different diseases like maple syrup urine disease, isovaleric acidemia, multiple carboxylase deficiency, propionic and methyl malonic acidemias. So in all these conditions, the blood pH becomes very acidic in nature. Okay, in maple syrup disease, branched chain amino acid, too much of branched chain amino acid in the system, that would lead to branched chain amino acids being excreted by the kidneys, and that gives a sweet odor to the urine, like that of maple syrup. That's why the name is maple syrup syndrome. So children will have other presentations as well, like it will be difficult to feed these children. They will have a shrill cry. Okay, they are hyperactive. They have flaccidity, that is, they don't have muscle strength. They may go into a stage of comatose. Convulsions will be there. Seizures will be there. So special formulas are present which are very low in branched chain amino acid. Okay. Small amount of branched chain amino acid should be provided because that cannot be synthesized in the body. But formulas which are low on branched chain amino acids are given. Large doses of thiamine-based food can also be added. And some children will require dialysis, peritoneal dialysis. In even isovaleric acidemia, there is a sweet odor in the urine. Again, a low protein diet is given in that. Multiple carboxylase deficiency. Carboxylase enzyme is not present. So it's a cat kind of a urine smell. Biotin supplements are required. Glycine, that's a non-essential amino acid. Your body can synthesize it. And glycine is absent in breast milk. So when too much of glycine is been synthesized in the body, it leads to hyperglycinemias, too much of glycine in the blood. So that can produce ketosis, acidemia, different types of acidemia that we have discussed earlier. The blood becomes acidic in nature. Then there is no ketonic acid hyperglycemia. So it causes mental retardation, microcephaly, seizures, and if it is severe, it can push the child into coma or death. So low glycine diet is given. Child can have breast milk. Low protein diet has to be given. Folate and exchange transfusion are also tried. And if the central nervous system is affected, diazepam is a medication, psychotic medication. It can be given. Then oxalosis and hypero, hyperoxaluria. So here oxalic acid, too much of oxalic acid in the system. So that will be removed by the kidney. So it leads to oxaluria. So oxalate rich food like horse gram, kesari dal, amaranth, curry leaves, drumstick leaves, spinach, plantain flour, almond, cashew nut, gingerly seeds, amla, tea, coffee. These things has to be avoided. Then you have urea cycle disorder with hyperammonemia, too much of nitrogen in the blood. That is a urea cycle disease. Produces vomiting. The child does not want to eat. That is, the child is not able to breathe properly. It could be coma as well, comatose as well. Agitation, confusion, ataxia is present. The body is not able to metabolize certain essential amino acids like arginine, non-essential amino acids like citrulline and ornithine. These are not metabolized in the body properly. So that leads to urea cycle disorder. Carnitine can also be given as a supplement here. Arginine has to be avoided. Which all essential amino acids is causing urea here cycle disorder, that has to be avoided. Then histidine deficiency could lead to urocanic acid disease, in which green brown color is found when you do the ferric chloride test of the blood. So the children who have histidinemia, too much of histidine in their system, they have growth retardation, mental retardation, speech defects. So histidine deficient diet is given, that is again low protein diet. Then glutaric aciduria. So this is an genetic condition, autosomal recessive genetic condition, in which glutaric acid is secreted by the system. It is not being absorbed properly, and too much of glutaric acid is present because of maldigestion, not able to absorb properly, metabolize properly. Glutaric acid will be present in the blood, and it will be taken away by the kidneys in to the urine. Okay, so that leads to glutaric aciduria. So low lysine diet is given. Carnitine supplement can help in this situation. Special formula is also available for such disease conditions, which does not have lysine and tryptophan, but it is very expensive. These formulas are expensive. Generally, you can give the child low protein diet with just cereals. Next, coming to the metabolism of lipids. So you have the Refsum disease or Refsum syndrome. So in this disease, uh, long chain fatty acid metabolism is not taking place in the system. So the child who suffers from Refsum disease will have a broad gait. The child will walk like separating two legs too far from each other. Okay, there will be ataxia, hearing loss. There could be a atypical retinitis pigmentosa, that is a bruising kind of a pigment on their skin. So diet that contains phytic acid has to be avoided here in Refsum disease, like green vegetables, spinach, nuts, coffee, dairy products has to be avoided. Then you have lipid storage disorders. So we can't, there is no dietary management for that, only medical management is given. The way how the child is not able to store fats or storing excessive fat without breaking down into energy. Okay, those are the lipid storage disorders. Then lipoprotein metabolism and transport disorders, like too much of, if lipoproteins are absent or lipoproteins are not being made in the system, okay, too much of lipoproteins are present. So that could lead to lipids staying in the blood. So it could lead to hyperlipidemia, cholesterol issues in children. Then carbohydrate metabolism disorders, fructosemia, fruits, honey, high fructose fruits has to be avoided here. The enzyme that converts fructose into glucose, okay, that is absent. So high fructose food will be avoided. Otherwise, progressive liver disease can take place. Then you have galactosemia. So here the child is not able to produce the enzyme that can convert galactose into glucose. So too much of galactose will be present in the blood. So lactose-based products has to be avoided. In dietary management, milk sugar, that is lactose, should be avoided. So all milk products, milk and milk products has to be avoided. No dairy creams should be given. Soya protein can be used here. Avoid all baked items as well. Soya protein as isolate can be given. Strict dietary restriction is required here. And when the child reaches school age, somewhat it can be relaxed. Yes, that all these conditions, diet planning is done by pediatricians. Okay. Blood test, blood test will show you, blood and urine test will show you how to identify these conditions. Usually when the child is born, the child is not putting weight, the child shows shrill cry, the child goes unconscious. Okay, when these symptoms are seen, immediately blood test or urine test is done, and that's how it is diagnosed that the child is suffering, newborn baby is suffering from these conditions. And from then onwards, the child will be on formula diet, not on breastfeeding, or based on whatever we are discussed. Okay, those diet has to be followed. But usually it is seen that when the child grows up in school age or teenagers, slightly you can relax these uh, strict diets here and there. The child's body becomes more attuned to overcome any food intolerances. Okay, they don't recover. These conditions are lifelong. So for lifelong, they have to follow the dietary restrictions. But when they grow up, slight relaxation here and there you can do with the help of medication. Okay. Then you have glycogen storage disorders. So in galactosemia, what has to be eaten, what has to be avoided for lifelong, there is a table given on page number 34. You can see that. In milk group, soya milk can be included because soya milk is the only milk, plant-based milk, that has all the essential amino acids. Okay. So soya milk is a good replacement of cow's milk or any dairy milk. Okay. But avoid soya flour because in that some milk-based products can be used. Cereals and pulses can be used sparingly. Fat and oil without any milk can be used. So no butter, no ghee. But fruits and vegetables can be included. Organ meat has to be avoided. Only the muscle meat and egg and fish can be given. So in glycogen storage disorders, these are enzyme disorders. So that could lead to hypoglycemia, the way how the body, the enzymes convert glycogen into glucose. Those enzymes may be absent. The body is not producing those enzymes. So the body goes into a state of hypoglycemia in the early morning, because at night you ate something, by 7 o'clock you ate something, and then you are sleeping. Okay, so you are in a fasting state for at least 12 to 14 hours. Okay, so your body but still is functioning. Okay, it is burning energies. So by the morning time when you wake up, you become hypoglycemic if you don't have the enzymes that can convert the glycogen stored in your liver back into glucose. Okay, so if you don't have that enzyme, your body will not get glucose and you go into a state of hypoglycemia. So in such conditions, frequently day and night feedings should be done. Even at night time, continuous feeding has to be done. NGT feeding can be done. Uncooked cornstarch can help them because it is slow in absorption. Resistant starches can help them. Cornflakes meal for dinner could be beneficial, which is high in carbohydrates. Then mucopolysaccharide conditions. So these are also different types of carbohydrate residues present. So purines and pyridamines. If there are purines and pyridamines along with ribose and deoxyribose are essential for making DNA and RNA in your body. But high purine, that is uric acid, that could lead to gout. Okay. So when a person is suffering from gout or gouty arthritis, uric acid will destroy the synovial fluid that is in your joints. Okay. So that's how you get arthritis. So too much of uric acid in your diet can lead to uric acid stones in the kidney. It can lead to gout. Okay. So food that is rich in uric acid has to be avoided, like beef, chicken, pork, liver, sardine, spinach, cauliflower, chocolate, cocoa. This has to be avoided. Then porphyras. Next condition is porphyrias. So this is a disorder of heme biosynthesis. Okay, hemoglobin, heme. That's a component, that is the ferrous part. That is the iron containing part. So children who suffer from porphyrias, they have to have liberal calories. You can give them high carbohydrate diet. Okay. Beta carotene supplement is also beneficial for them. Then renal stones or urolithiasis, kidney stones. So based on what type of stone is diagnosed, okay, you have calcium stones, uric acid stones, oxalate stones, cystine stones. There are different types of stones. Okay, so based on the type of stones that you have, food that are rich in those components has to be avoided. So table 34.28, you can check oxalate rich items. If you are suffering from oxalate stones, oxalate rich items has to be avoided. If you are suffering from uric acid stone, uric acid rich items has to be avoided. Calcium stones, which is most common, avoid calcium rich items like crab, prawn, gingery seeds. Gingery seeds means sesame seeds. Amaranth, spinach, ragi, milk, chocolate, cocoa, sardines. Like this ketogenic diet or keto diet. So it is found beneficial in infants and children who have myoclonic seizures that are a type of seizures, convulsions. Okay, so keto diet was basically introduced to combat seizures in children. Okay, it was not a weight loss diet. It was used to combat seizures in children. And for 1 year or 2 year maximum, the child will be put on ketogenic diet and slowly normal diet will be reintroduced. So that is the function. So 80% of the calories in ketogenic diet should be given by fat because you are not depending on carbohydrates to give you energy. Okay, you are making your body's fat to be converted into energy. You are teaching your body to convert fat into energy. So you put the person on a low carbohydrate diet. 20% protein, 5% carbohydrates, and 75% energy could come from fats. In some cases, 80% energy will come from fats. Okay, 15% will be from protein, and 5% will be from carbohydrates. So that's how you divide the ketogenic diet. And the fats should be healthy fats, not trans fat or saturated fat. So ketogenic diet can also be done in different phases. So first phase is the induction phase, in which the body goes into a switch from glucose metabolism into ketosis when there is too much of ketone bodies that are produced in the system. 4 to 5 days induction phase will be done. And this is done to train the parents how to feed the child, to teach the parents what is the importance of keto diet. Then the child will be put on fasting for 1 day to make sure the child goes into a state of ketosis. Only water is given or water equivalent is given orally. Urinary ketones are checked regularly using the dipstick method. Blood glucose level is also monitored every 6 hourly, so the child that does not go into a state of hypoglycemia. If there is a dangerous levels of hypoglycemia, if a child goes into a dangerous level of hypoglycemia, immediately an orange juice with sugar will be given till the blood sugar levels are improving. So ketogenic diet has to be introduced gradually, not immediately, day by day. And patients are also checked, parents are also taught how to check the urinary ketones and how to maintain a seizure chart. Okay, detailed item-wise diet plan is given to the parents, taught them how to do food exchanges, how to do menu planning. Instructions on how to weigh and prepare recipes are given. If constipation is there or any GI gut problems are there, it is treated symptomatically. Calcium, zinc, selenium, vitamin A, vitamin B12 deficiencies can be tackled by giving supplements in ketogenic diet, so that other nutritional supplements, so that other nutritional deficiencies should not occur. And it's a team of neurologist, pediatrician, and a dietitian who will take care of the patient and teach the parents throughout the ketogenic diet phase. So that's about the chapter of medical nutrition therapy. If you have any queries, you can mention in the chat box.